So good morning. So I'm gonna perform an easy PAP. So first and foremost, make sure we check the patient's chart. So once we're done taking up any information, we go inside to the patient's room. So we always make sure we introduce ourselves, tell them that this one is an easy PAP. This would help them benefit from clearing up their secretions, clear up their airways, and also it would prevent their lungs from any atelectasis or collapse. So after that, make sure we reposition the patient in an upright if they can, and then double check the patient's ID band for confirmatory purposes. And then before starting the therapy, make sure we always do our patient assessment and obtain vital signs. So when doing this one, it is important to demonstrate or in front of the patient so that they would understand really well. And then with this is we can either use it with a pressure monitoring port. So we're gonna put it inside in here in this port. Make sure it's secured, and before using this device to the patient, make sure we inspect any cracks present. And then this other port is for the oxygen tubing, which we're gonna be attached it later on the flow meter. And then when you attach both of them, make sure it's secured or tight. And then another thing is when holding this one up, the patient should hold it like this, not in the downward position, because with this we will notice the white piston to rise up with the pressure monitoring port. And then they should also not obstruct in the back to prevent from any occlusion, because it is not contraindicated to block the other part. And then you can also use it together with a nebulization treatment, because with a nebulization treatment where we're gonna put it with a T adapter with its medication cup, it would help restore or normalize improve their lung volumes. So with this, let the patient take a slow deep inspiration. After that, let the patient take a strong exhalation, but not in a forceful way. So after that, when the patient does use this one, ideally we should not let the patient do it more than 5 times initially to prevent any complications. And then if the patient can tolerate it later on, we can gradually increase the trials or attempts. And then every after attempt, let the patient cough, let the patient rest for a few seconds, and whenever the patient expectorates, take note of the color, consistency, and the amount of their sputum. So assuming we start it up, we ideally start it with a flow of 5 liters. And then we should not let the patient take too much inspiratory flow, such as not more than 60 liters per minute. So with this, we take this one to the patient with a mouthpiece with a tight good seal with their tongue underneath. If the patient could not tolerate the mouthpiece, we'll also have an option with a mask. So once we're done, take this one, remove it, turn off, and then the pressure monitoring port should be disposed. And then make sure every therapy this one is covered. If we no longer use the monitoring port, we should not expose this one to any ambient air. They should not be soaked, should be air dried. The mouthpiece should be cleaned with a sterile water. And then if we're done with the therapy, we should always make sure we do another set of vital signs and post assessment. Once we're done, go outside, make sure we wash our hands, chart everything that we take note to the patient, especially if how much pressure they're able to reach, communicate with the staff and the physician.